is a right. Healthcare is a right.
They say they train to cure diseases, not check immigration documents. Rita is a doctor who thinks the new rules, requiring NHS workers to make sure patients are eligible for free care, are unworkable, even immoral. She's based in a part of London with high immigration. Although most Europeans and people needing emergency care or with infectious diseases don't have to pay, she worries the new rules may prevent the sick from coming forward.
When people don't seek healthcare when they need it, then their conditions become worse, and then they'll be eligible for urgent or immediately necessary treatment, which will incur charges to the NHS, and the charges will be much more than the charges would have initially been for more standard secondary care.
In theory, the NHS has already been charging non-eligible foreigners. The difference now, it's asking for money up front. But how does that work in practice? This Indian woman told me she's been repeatedly asked for identification documents in NHS hospitals in recent months.
It's actually not about your immigration status, it's just about whether you look British or not. And that has a serious impact on, whether or not I decide to go in for treatment sometimes.
You say you're being racially profiled.
Yeah, definitely.
Not for racist deportation.
These health workers are obviously unhappy, but they're not the only people exerting pressure on the British government. The NHS is undergoing a funding crisis as it struggles to cope with a growing and ageing population. And the government is sensitive to the perception that some foreigners are not paying their fair share.
The government did not grant us an interview, but provided this statement. It says that overseas visitors are welcome to use the NHS, which is paid for by British taxpayers, and that visitors must also make a fair contribution.
If we decide to spend the money on providing a national health service that's actually an international health service for the whole world, then that's going to mean British citizens are going to have less to deal with cancer, to deal with long-term conditions, to deal with elderly care. So there's always going to be a cost.
But how much money will the new regulations raise? The protesters, and even the government projections, say they'll be worth a very small percentage of the overall NHS budget. Barnaby, Phillips, Al Jazeera, London.